Very much for having me. Congratulations on a great meeting. And I think thank you for asking me to give this talk following Samir, Innovation in Aortic Valve Therapy's top 5 latest innovations that are not TAVR. So that was difficult enough in itself. And then a couple weeks ago, Paul reached out to me and said, oh, by the way, can you give another talk on the same subject? New aortic valve innovations you don't know about. So this is my conflict of interest disclosure. So what I'm going to do is to divide surgical innovations into 2 7-minute talks. And I'm going to talk about 3 innovations that are not TAVR in aortic valve and ascending aortic surgery. So the first thing I'm going to talk about is sutureless aortic valves, and then the concept of enhanced tissue preservation, and then thirdly, aortic annuloplasty rings. So there are 2 sutureless surgical valves on the market. One is the Edwards Intuity valve that you see on the left, and the second is the LivaNova Percival valve on the right. So why a sutureless valve? It's kind of a hybrid between TAVR and a surgical valve. The idea is that if you don't have to suture the valve in, then you can, number one, shorten the amount of time that you're on cardiopulmonary bypass and have an ischemic arrested heart. Secondly, you can facilitate minimally invasive surgical aortic valve replacement, because the most technically difficult part of going through a small incision is the suturing. And if you can eliminate that, then you can facilitate more minimal access surgery. And the third is, because you don't have the sewing ring and cuff on it, you can get larger EOAs, especially in small aortic roots, so that the orifice areas are closer to TAVR than traditional surgical valves. So here's a patient with a minimally invasive surgical aortic valve replacement, and these are done either through a partial upper sternotomy or a right anterior thoracotomy. So this is the Edwards Intuity valve. It's like the surgical valve. It's bovine pericardium that's thermofixed. And it has a balloon expandable stainless steel frame on the bottom, and it's got a polyester sealing cloth on it. There is a balloon delivery system that once the valve has been placed in the aortic annulus, balloon expansion occurs, and you can see in the upper right corner what it looks like in the undeployed versus the deployed position. So this is a animation on the left and a surgical procedure on the right that shows the concept here. There's 3 stay sutures that are placed to anchor it in the proper position, because it's difficult to exactly see where you are. And then once it's in position, the endoflator is inflated and the balloon expansion occurs. So you can see on the right, the valve has been opened and valve excised. And then the valve is put into place. For some reason, it's not going to that. The second valve is a little bit different, and it's the Percival valve by initially Sorin, now LivaNova. And it's got a interesting stent design that the lower stent is anchored in the aortic annulus, and the upper stent is anchored just above the sinotubular junction. And between those, there's access to the coronary arteries. And this is looking at the mean gradient and EOAs of the Percival valve compared to standard surgical valves, and you can see that the mean gradients are lower, more in the range of TAVR. The second concept is enhanced tissue preservation. Now, what does that mean? So this is the new valve from Edwards called the Inspirus Valve. And there's a couple aspects of this that are somewhat unique. So why do biologic valves deteriorate? They deteriorate because of the method of fixation that's used. And it's all glutaraldehyde fixation. And not only is the tissue prepped that way, but it's stored that way in glutaraldehyde. And that causes free aldehyde radicals on the tissue, and those radicals attract calcium. And those calcium bind to aldehydes. So the tissue treatment that Edwards has come up with is called Resilia. And Resilia is a blocking agent that blocks the free aldehydes and prevents calcium deposition from happening on the leaflets. The second benefit of it is that these valves can be dry stored so that there is no washing that's necessary. And this technology is being incorporated into TAVR also. So in the animal studies, so this is juvenile sheep, which is the standard animal model that predicts calcification of tissue, that the Resilia tissue showed a 72% decrease in calcium content at 6 months, and the effective mean gradient was significantly higher. And this shows the Resilia tissue on the left and the standard perimount valve on the right at the same period of time, and you can see the calcium deposition happening on the standard surgical valve. So this valve is available now, and what we've been trying to do is how to demonstrate this is really effective in humans without waiting 10 years to determine whether the valves don't deteriorate or not. So there are methods using 4D CT now of looking at microcalcification early and determining whether this really is a better tissue treatment or not. The other benefit of the Inspirus valve is that not only theoretically does it calcify less and can be stored dry, but it has a frackable frame. So in other words, it's designed for subsequent valve-in-valve, where that number 3 is marked on the valve frame there. It's fracturable at that standpoint, so this valve can be significantly expanded at the time of a subsequent valve-in-valve. And then the third concept is an aortic annuloplasty ring. Now, why on earth would you want an aortic annuloplasty ring? Well, it's for what's called the David procedure, which is aortic valve-sparing root replacement done with patients with ascending aortic aneurysms, and that the native leaflets, a native valve, can be spared. So the steps of the David operation, or a valve-sparing root, is you excise the aneurysmal ascending aorta, and then you place an aortic graft with sinuses present on it over the valve. The native valve is then sewn into the graft, and then the coronaries are reattached to it. Well, this is one of the most technically demanded operator-dependent operations in cardiac surgery, and it's why it's only done by a limited number of surgeons in a limited number of centers. So this idea of creating an annuloplasty ring is to allow this procedure to be more standardized and potentially more durable. So this is the concept that the ascending aorta has been excised. This annuloplasty ring is put in at the aortic valve, and the valve resuspended on this stent, and the own native leaflets are preserved. The greater degree of aortic insufficiency you have, the less well and less durable patients undergoing a valve-sparing root do, and it's thought that this is, the theory behind this is if you do this, then we can save more valves with aortic insufficiency. So I'll stop there and talk about the remaining aortic innovations in 7 minutes after Dr. Holmes gives the next talk. Thank you.
Thank you, Mike. Thank you.